Hello everyone and welcome to HIM 216. In this lecture we are going to discuss Chapter 1. In your textbook you've probably noticed that it is a very short chapter. One of the things that I want to talk to you about is how to begin your studying session for each of the chapters in this textbook. I would like for you to open your textbook and turn to page 1. And this is the beginning of Chapter 1. And what I want you to notice is that there are learning objectives for the chapter. Then there are abbreviations and acronyms. And you need to read these before you start the chapter. Understanding abbreviations and acronyms in healthcare, and particularly with federal payers, is a foreign language. I'm just going to tell you right now, it changes all the time. I listened to a webinar earlier in the week and I printed out 3 pages of acronyms that they were using, and I had to reference them because it's a new program and they just make this stuff up all the time. The other thing that I would like for you to do is turn to page 7 in your textbook, and before you read a chapter you should look at the chapter review exercises. You'll be able to see what your homework assignment is. Usually, but not always, it is the chapter review exercises at the end of the book, the end of the chapter. Sometimes you're answering all of the questions, sometimes you're just answering the odd-numbered questions. And I have had students that have made a copy of these pages and had so that they had them to review while they were going through the chapter. And then I want you to look at the glossary, at the chapter glossary, and that follows the chapter review questions. In your book it's on pages 8 and 9. So that's always a good place to start when you're going to be reading a chapter. It gives you an idea of what it is you should be learning while you're reviewing that chapter. I want to talk a little bit about coding. When we're talking about medical coding, and that's what we do, is medical coding. If you talk to someone who is not familiar with health information management and medical coding and you talk about coding, they may think you're talking about computer programming, which is also referred to as writing in code or coding. So medical coding is probably very different from anything that you have done before. The classification system that we use for diseases is ICD-10, and the World Health Organization actually creates and maintains the International Classification of Diseases. In the United States, the cooperating parties create a clinical modification. So we use ICD-10-CM for our diagnosis coding. CMS actually, in conjunction with 3M, created the procedural coding system, ICD-10-PCS. This classification system is only used for hospital inpatients. We'll study that in, I believe, Chapter 6 in this, well, Chapters 6 and 7 in this textbook. So our focus in this course, 216 and 225, the course that you will take in the following semester, are in ICD-10-CM and ICD-10-PCS. CPT is another classification system. You'll take that in another course. These are what we'll focus on. A little later on, we'll actually look at the official coding guidelines. Our focus in this course is inpatient coding. Unfortunately, they have removed the chapter that covered outpatient coding. So you'll pick that up in 141. We'll be using the AHIMA Virtual Lab 3M classification, the 3M grouper software. We'll be using the integrated code book, which is exactly the same as a paper code book. It's just electronic, so it is much easier to use. Coding as we know it now is used for a number of things. It is used for reimbursement. It's used for research and planning. Standards of care are based on coded data. Coding is a huge risk area for organizations. It's very regulated. It's very audited. We absolutely must have consistent data quality, and the way we accomplish that is actually by following the coding guidelines. There's a difference in a nomenclature and a classification. Those are discussed in your textbook on Chapter 1. The definitions are included in the glossary as well. Some of these slides I'm not going to go over because you can read these in your book. Typically during my lectures I don't use the PowerPoint slides. I'm actually in 3M teaching you how to find these ICD-10 codes using the integrated code book. One of the things that is important is that ICD-10, CM, and PCS are maintained by what are called the cooperating parties, and that is NCHS, and then CMS, the American Hospital Association, and AHIMA. I will tell you that CMS typically drives reimbursement in the United States. There are a couple of websites. There's cms.gov, which is really a website that is designed for providers. And then there is a medicare.gov, and that website is typically designed for consumers. So sometimes it's beneficial to go to medicare.gov because things are typically in layman's terms, so they're easy to understand. And then go to cms.gov, which actually includes all of the technical information about all the different ways that all the programs they reimburse for, how they reimburse for. It is very complex. You're going to be, over the course of your coding classes and reimbursement classes, you're going to be completing web-based training that is at the cms.gov website. And the training will provide you with excellent information on the different reimbursement systems in the United States. Now, every provider that bills for services must use the standard classification system, and this was a part of HIPAA when HIPAA was passed, administrative simplification. So if a hospital wants to be reimbursed for the services that they provide to their patients, it's got to be coded. Those codes go on to the bill, and the bill is sent electronically. Physician offices, outpatient surgery centers, any facility that cares for patients and bills for that care. Insurance companies use the codes because obviously they're receiving them, from the providers, and prisons also maintain this data, and government agencies. One of the reasons we do code is to maintain databases that we can search to give us information about the kinds of patients that we're treating, what their diagnoses are, what their comorbid or complicating conditions are. All of that data is coded. Oops. There are several organizations that provide credentials for coding. AHIMA has a number of credentials. If you go to the AHIMA website, ahima.org website, you can choose the certification tab. It will list all these credentials for you. The Registered Health Information Technician Certification Exam is the exam that you will be taking either during your last semester in this program or right after you graduate. This is the credential that's associated with an associate's degree. The RHIA credential is the credential that is associated with the bachelor's degree. And the AAPC also has coding credentials, and there are many HIM professionals that hold dual credentials. So they have credentials from AHIMA and they have credentials from the AAPC. These are very well recognized in physician offices in some of those outpatient settings. So many times when they're hiring, they will actually require that the person that they hire either hold this credential or take this credential. Once you have obtained a credential, in order to maintain it, you're going to have to complete continuing education units. Depending on the credential, there are a minimum number of hours required for that certification. If it's an AHIMA credential, you actually have to log those at AHIMA. You have to pay them to log those for you if you are not a member. And you must maintain those. You must complete the continuing education hours or you will lose your certification. So that is a very important process. And you'll go over that in more detail, I believe, in HIM 110, or you did go over that. These are the credentials and the requirements for those credentials. This is in your textbook, so I'll let you review that there. It's also very important to note that there are standards for ethical coding. Both AHIMA and AAPC have these ethical coding examples, and the reason that it is so important to follow guidelines and to code appropriately is that it impacts reimbursement, so it's a huge risk for providers. And also the data is used nationally to report out and evaluate standards of care, patient outcomes, and those types of things. So the data is critically important. Compliance is huge. Compliance is monitored by the OIG. We must follow the rules. If coding rules are not followed, it is either fraud or abuse, and organizations and providers can be prosecuted. One of the things that can happen is you can be excluded from Medicare and all federal payers. Basically, if that happens, you probably just about have to close your doors, because a large majority for most providers, depending on their specialty, usually somewhere between 30 and 50 or 60% of their patients have Medicare or Medicaid, TRICARE, some federal payer program. And if you're excluded for one, you're excluded from all of them. And actually individual people can be excluded. When a new person is hired in a healthcare organization, they actually have to query a national database. And if that person has been excluded and they work in that organization, any patient they take care of cannot be reimbursed by a federal payer. So obviously they don't get hired. And unfortunately, where you see this very often is in nursing homes, where there have been allegations of patient abuse and they've been investigated and the provider has been found to be abusive and they've been prosecuted, and when they're convicted then they are excluded from Medicare programs, which means they'll have a very difficult time working in healthcare. They don't stay excluded forever. I've seen lists of people who have come off the exclusion list, but that exclusion list goes out on a regular basis, and if you're hired in a healthcare organization, they will make sure that you are not on that exclusion list. When we're talking about complying, we have CMS rules. We have state agencies. So in South Carolina, you know that we have the State Department of Health, and we do have state regulations that actually govern the requirements for hospitals and physician offices, what their documentation requirements are, how they have to operate their businesses. And then Joint Commission, they're an accrediting agency. Any accrediting agency is going to have requirements for the way that healthcare is provided in an organization. And then HIPAA was enacted in 1996, and this standardized healthcare. It also required that facilities have privacy officers and compliance officers, and so those folks actually administer those required programs in healthcare organizations. When you work in an organization, you have to make sure that your department is compliant. And in health information management, we do have policies and procedures specific to coding, and basically they say, those policies and procedures say that we will follow the official coding guidelines and use the most current edition of ICD, and that we will monitor our department functions to make sure that we continue to be compliant. Confidentiality is huge in healthcare and health information management in many organizations. It's covered in the Patient Bill of Rights that we post in our facilities, and it's required by HIPAA, and our patients also receive privacy notices. I'm sure you've all gotten a privacy notice at a facility. You may have gotten dozens of privacy notices. And then, of course, with confidentiality, you do follow a common sense, need to know approach. But in the end, we have to follow our policies and procedures. Now, typically during or at the end of any lecture that is going to be graded and be a part of the grade book, I will give you a question that you have to answer. And you actually will open the assignment that included this link, and you'll just, when you open the assignment, you'll just type in the answer. You will not create a Word document and attach your answer in a Word document. You just answer it within the assignment. So your question for this lecture is, before you begin studying a chapter, what do I recommend that you review? So before you start reading a chapter, I've made some recommendations about what I think you need to review before you start reading that chapter. What were those things? The other thing I'll also include for you in the last, many of these chapters will have, including chapter 2, will have many lectures. During the last lecture, I'll go over the homework assignment. For chapter 1, you're answering the chapter review questions, and you need to answer the questions first, then open the assignment and answer the questions in the assignment. For chapter 1, I believe that the questions actually are retyped for you, but once you start coding, the questions are not going to be retyped. You'll answer them in your book or your workbook, you'll open the assignment, and you'll enter your answers. Now, for the workbook, in your workbook, chapter 1 starts on page 1. There are glossary definitions. You'll answer all of those glossary definitions. And then there are multiple choice questions. 8 of those, you'll answer those multiple choice questions. Now, this is very important. You do not type out the answer. You type out the letter that corresponds to the answer. So, for instance, when we're looking at the glossary definitions, you would look at ethics. You would find the correct answer for ethics, and whatever letter of the alphabet that definition corresponded to, that's what you would enter in the homework assignment. You would not actually type out the definition, just the letter of the alphabet that corresponded to that answer. And the same thing for the multiple choice questions. Only put in the letter that corresponds to the correct answer. Don't put, for number 1, if the answer were A, don't put A period anatomy. Just put in A. If you have any questions, please do get in touch with me, and I think we'll have a great time in this course learning about coding. And that will conclude this lecture.